This video will cover bottle feeding, including donor breast milk and formula. Our takeaways will include reasons your care providers may encourage you to supplement your breastfeedings, a brief overview of donor milk and formula, and a review of frequency of feedings. There are many reasons that your care providers may encourage you to supplement with either formula or donor breast milk. Some of these reasons may include hypoglycemia or low blood sugar, non-satiated feedings where baby's feeding longer than 30 minutes, more frequently than every 1 to 2 hours, and is still crying and seeming unsatisfied, being very sleepy, lethargic, and limp, excessive weight loss, reduced dirty and wet diapers, signs of dehydration, and jaundice. Besides supplementing with your own pumped milk, which is often not in until about 3 to 5 days after birth, donor breast milk and formula are great options. Donor breast milk is from mothers that make more milk than they need to feed their baby. They donate their extra milk to be used to feed babies that need it. There are milk banks that then collect this milk and pasteurize it to kill any bacteria in the milk to make sure it's safe. Babies can get this milk in the hospital and at home. Follow the milk banks in your pediatrician's guidance on preparing donor milk for feedings. Talk to your pediatrician if you have any questions regarding donor milk for your baby. Formula is another great option. Many hospitals offer pre-made bottles of formula. Outside of the hospital, there are liquid and powdered forms. Talk to your pediatrician if you need guidance on choosing the formula or you're thinking of switching brands or types. When preparing your formula, make sure you have clean hands and that the bottles are cleaned and sanitized. Milk and formula do not need to be warmed up before feeding, but if you choose to do so, make sure you do not use the microwave, as this can create hot spots that burn your baby's mouth. Place the bottle under warm, running water and test a few drops on the back of your hand. When preparing powdered formula, make sure your water is safe. If you're unsure, contact your local health department. Follow the manufacturer's instructions on preparing the formula. Store unopened formula containers in a cool, dry indoor location. Use prepared formula within 2 hours of preparation and within 1 hour of the start of a feed. If you're not going to use it within 2 hours, make sure you put it in the fridge and use it within 24 hours. Throw out formula that is left at the bottom of the bottle after a feeding, as baby saliva can cause bacteria to grow. Whether you are using donor milk or formula to supplement your breastfeeding or are exclusively using them for feedings, your newborn's belly is tiny. He or she does not need a lot of donor breast milk or formula right away. Many newborns feed every 2 to 3 hours in their first few weeks of life. Some infants that are exclusively bottle feeding can feed every 2 to 4 hours. Make sure you also pay attention to your baby's hunger cues as well. As your baby grows, their belly will grow as well, and they'll need more and more milk. You don't want to give your baby too much right away, as it makes them more likely to spit it up. If you have any questions, make sure you connect with your pediatrician. Thank you for watching this video on bottle feeding with donor milk and formula. I hope you have a better understanding on reasons your care providers may encourage you to supplement your breastfeedings, about donor milk and formula, and about the frequency of feeding. Thank you.